Before we get started, I'm asking you to watch this video to the very end. This may be the most important column that I've done in my career at Energy Media because it deals with the health of Canadians from across the country. In fact, even life or death during the COVID-19 pandemic. So let's get started. On Thursday, November 26th, yesterday, the CBC in Alberta ran a story about 20 secret audio recordings of meetings between the Chief Medical Officer, Dr. Deena Hinshaw, and her staff in emergency committee meetings with the government of Alberta officials and politicians. So the recording suggests that Dr. Hinshaw was too deferential to her political bosses, Premier Jason Kenney and Health Minister Tyler Shandro. Professor Ubaka Ubogu, a law professor at the University of Alberta, argues that she should be much more assertive. Under Section 29 of the Public Health Act, gives her the authority and obligation to enact measures to protect Albertans during pandemics. Here's what Section 29 says. The Chief Medical Officer of Health may do any or all of the following. First of all, take whatever steps the Medical Officer of Health considers necessary to A, suppress the disease in those who may already have been infected with it, to protect those who have not already been exposed to the disease, C, to break the chain of transmission and prevent spread of the disease, and D, to remove the source of infection. She can do this by order, to A, prohibit a person from attending a school, B, prohibit a person from engaging in the person's occupation, or C, prohibit a person from having contact with other persons or any class of persons. And she can do this for any period and subject to any conditions that the Medical Officer of Health considers appropriate. So there's no question, according to Professor Lorian Hardcastle, that Dr. Hinshaw has the legal authority and obligation to act on her own, independent of the government, to protect Albertans from COVID-19. So the question is, why isn't she? The answer is history. Section 14 of the Public Health Act gives Dr. Hinshaw an advisory role to government. And this is true for chief medical officers across the country. And for decades, this has been their relationship with government, purely on almost entirely advisory. According to Professor Hardcastle, Dr. Hinshaw's advisory role under Section 14 is now in direct conflict with her legal obligation to act on her own under Section 29. So the question is, how should Dr. Hinshaw act as the pandemic worsens, threatening to overwhelm the Alberta hospital system?
So this is a really sort of strange position to be in because there are these allegiances that she should have to public health and science, but then the government has put her in this role where, well, you're actually going to wear our political decisions. And that's the strange part to me, is that, you know, we need to rethink the act. And if decisions are going to emanate from government, then the orders should have the government's name on them and not hers.
Dr. Hinshaw continues to emphasize her Section 14 role as an advisor to the government, which then decides if it will accept some or all of her recommendations or choose its own options. But once they've done that, she then issues orders under the Act to implement the government's decisions. So here's the key question. What if a government enacts weak measures that don't do enough to protect its citizens? Should the chief medical officer step in to enact tougher measures in line with the best scientific evidence and public health policies? The Alberta government's new pandemic rules arguably are too weak. So for instance, they brought in mandatory masking in Calgary and Edmonton. Well, they already have municipal masking mandates. So how does the provincial one, how is it an improvement? It prohibits socializing with visitors at home, but Albertans can still go to casinos, worship in a church, or eat in a restaurant. And as many people have pointed out on social media and elsewhere, that just seems inconsistent and doesn't make sense. So, and I know from the interviews that I've done with Alberta doctors that the provincial hospital system is maybe only a week or two away from being completely overwhelmed by the new COVID-19 patients that are coming because of the big numbers over the last week or so. I mean, at one point, it wasn't that long ago that Alberta had almost 1,600 new COVID-19 infections, which was more than any other province, including Ontario and Quebec. And Ontario has 3 times the population. So Alberta's got a real problem here. So this would be seem to be a significant threat to the health and welfare of Albertans, which Section 29 of the Public Health Act says the Chief Medical Officer, Dr. Deena Hinshaw, must protect during the pandemic. That seems to me to be, pretty clear. So, should Dr. Hinshaw ignore Premier Kenney's directives and issue new orders based on the best science and public health policy? She has that authority, and she has the legal obligation under the Public Health Act.
Well, what exactly are her ethical obligations or her legal obligations? Because, she has this duty under the Act to act in the public interest. And then another ethical obligation comes from her role as a physician. As a physician, you have ethical obligations to do no harm and to do the best that you can for your patients. And we're not her patients, but there are those sort of ethical obligations as well. So this
ignoring the government's wishes and acting independently would have consequences. Of course it would. Premier Kenney is Dr. Hinshaw's boss, and he can fire her. Not only would she face the prospect of losing her job, but then there's this distinct possibility that Kenney would hire someone more compliant to replace her, thus making a bad situation even worse. Clearly, I think we're reading between the lines here, but this is probably the calculation that Dr. Hinshaw makes every day that she goes into work. So this is her dilemma, and there is no easy choice. There are no easy options. There is nothing simple about this. It's a really tough spot that she's in. In fact, chief medical officers, to greater or lesser degree, are in this dilemma across the country. Here's Energy Media's editorial position. We believe that Premier Kenney has allowed political considerations to affect his judgment. The reason for that is because his party, the United Conservative Party, is full of what Angus Reid, the pollsters, call cynical spreaders. These are people who refuse to wear masks. They don't believe in the best public health policy, and conservatives are 4 times as more likely than any other voter across Canada to be cynical spreaders. And they're already, across Canada, that's 18%, so you can imagine what the percentage would be in Alberta, probably between 30 and 40%. And Kenney, to many observers, including myself, appears to be trying to placate them by not being perhaps as tough with the new pandemic management rules as he should be. So the question is, should Dr. Hinshaw go over and above that and enact rules that maybe would protect Albertans, more thoroughly? Now, it's time for Dr. Hinshaw to basically screw up her courage and act in the best interests of the people and do what she has to do. And we know there are going to be consequences, but that's okay. She's in a tough role, and it's a very important role, and she can't continue to hide behind the government and pretend that this is the government's issue. The Public Health Act gives her the authority, it gives her the obligation, and she has to decide for herself whether she's prepared to accept it.